Hello, my name is Mighty Fine. I'm the Director of the Center for Public Health Practice and Professional Development at the American Public Health Association. I'm also a member at large on the Safe States Alliance Executive Committee, and I bring greetings from Washington, D.C. When I think about National Public Health Week, I think about this as an ideal time to reflect on our respective roles in public health, and then specifically for those of us engaged in work in injury and violence prevention. In thinking about community, collaboration, and resilience in the context of injury and violence prevention, I immediately think of partnerships. And by partnerships, this means involving communities most impacted by injury and violence prevention and ensuring that their voices are part of the chorus of solutions being created to address these issues. But in addition to community, it's also imperative to engage other sectors. This can be business, education, housing, planning, civic groups, local governments, and others. It's really thinking very broadly about who is impacted by injuries and violence, how are they impacted by injuries and violence, and then what sectors have a stake in that, and then inviting them to the table. I like to say that we no longer have the luxury to have non-traditional partners because injuries and violence impact us all in some way, even if not directly. And then those of us, including me, working at IVP can serve as the convener of these partnerships. And by doing so, we can ensure that these diverse identities, these diverse perspectives are all used to combine and bolster our current efforts, but also to think about and create innovative solutions to injuries and violence, which have been ongoing. And it'll help us to think about not just the absence of injury and violence, but also thinking about how do we create the presence of opportunity, and we can do so collectively. And then ultimately, I think that collaboration and community-led multi-sector partnerships and approaches will in fact help us to change and dismantle the systems that uphold disparities and inequities. And by placing our collective efforts and our collective approaches to address these issues, we will ostensibly help to create healthy and fulfilled communities. Happy National Public Health Week, all.